Your heart is beating right now, and you are not telling it to. Even as you sit perfectly still, doing absolutely nothing, it keeps its rhythm. And hidden inside that quiet, automatic beat is a number that quietly describes more about you than almost any other single measurement your body produces. This is your resting heart rate. Most people glance at it for a second on a watch and forget it. But doctors, athletes, and researchers treat that same number as a window. A window into how your heart works, how your nervous system is balanced, and how your body manages the invisible labor of keeping you alive. Most people think a heartbeat is simple. The heart squeezes, blood moves, the heart relaxes, repeat. But the reality is far more layered than that. Because your heart does not actually wait for instructions from your brain to start each beat. Tucked into the upper right chamber of the heart is a tiny cluster of specialized cells called the sinoatrial node. This is your body's natural pacemaker. It generates its own electrical spark, over and over, and that spark spreads through the heart muscle like a wave, telling it precisely when to contract. Your heart, in a very real sense, beats on its own. But this is where most people misunderstand it. If the heart sets its own pace, then why does that pace change? Why is it slower when you sleep and faster when you climb stairs? The answer is that the sinoatrial node is not working alone. It is constantly being whispered to by your autonomic nervous system, the part of you that runs in the background without conscious thought. And this is the real secret hidden inside your resting heart rate. Your autonomic nervous system has two opposing voices. One is the sympathetic branch, the accelerator, the part that prepares you for effort, stress, or danger by speeding things up. The other is the parasympathetic branch, the brake, which calms the body, conserves energy, and slows the heart during rest and recovery. A large part of that braking signal travels down a single remarkable nerve called the vagus nerve. So when you measure your heart at rest, you are not just counting beats. You are reading the balance between your accelerator and your brake at this exact moment in your life. This is the part patients usually never see. A resting heart rate is not really a heart number. It is a nervous system number wearing a heart costume. So how do we actually capture it? The oldest method is the simplest. A finger placed gently over an artery, feeling the pressure wave that travels through the blood with each beat, counted against a clock. A stethoscope listens to the same rhythm from the outside. But modern medicine goes deeper. An electrocardiogram, or ECG, places sensors on the skin to detect the tiny electrical signals the heart produces with every contraction. It does not feel the pulse. It watches the electricity that causes the pulse, drawing it as a precise repeating wave. And then, there is the device on millions of wrists right now. The optical heart rate sensor inside a smartwatch uses a method called photoplethysmography. It shines small green lights into the skin and measures how much light bounces back. With every heartbeat, blood surges through the tiny vessels just under your skin, and that surge changes how the light reflects. The watch reads those rhythmic changes and translates them into a beat count. So your wrist is not feeling your pulse. It is watching your blood move with light. But this is where it gets fascinating. The surprising part is what these devices are really searching for. They are not impressed by a single beat. They are listening for a pattern, a steady, repeating signal that they can trust enough to count. And the speed of that pattern, when your body is calm and undisturbed, becomes your resting heart rate. For most healthy adults, that resting number tends to fall somewhere in a fairly wide range, often described as roughly 60 to 100 beats per minute. But the number alone is only the beginning of the story, because two people with the same resting heart rate can have completely different hearts underneath. Consider the athlete. Endurance athletes often have remarkably low resting heart rates, sometimes well below the typical range. To an untrained eye, that might look alarming. But there is a beautiful mechanism behind it. With consistent training, the heart muscle becomes stronger and more efficient, and it can push more blood with every single contraction. This is called stroke volume. If each beat moves more blood, the heart simply does not need to beat as often to deliver the same supply. A low resting heart rate, in that context, can be a sign of a powerful, efficient cardiovascular system, supported by a strong parasympathetic brake. But the device cannot know that on its own. And this is the heart of the matter. The same low number that signals fitness in a trained runner might mean something entirely different in another person with different symptoms and history. A resting heart rate is a clue, never a conclusion. On the other side, a higher resting heart rate over time can have many ordinary explanations. Stress, dehydration, poor sleep, caffeine, illness, fever, certain medications, or simply having just walked up the stairs before measuring. A single high reading is often meaningless. What can be more interesting to a clinician is a trend, a resting heart rate that drifts upward or downward over weeks against a person's own usual baseline. Doctors do not interpret this in isolation. They place the number beside your symptoms, your history, your examination, and other tests, and only then does it start to mean something. This is why context matters so much in medicine. The machine can reveal a clue, but a trained professional must interpret the story. A waveform on a screen is just a shape until it is read by someone who understands what should and should not be there. The number on your wrist is honest about the rhythm, but it knows nothing about you. And there is a deeper reason your own baseline matters more than any chart. Resting heart rate is deeply personal. Age, genetics, body size, fitness, emotions, hydration, the time of day, even the position of your body when you measure, all of these shift the number. The most useful comparison is usually not you against a textbook range, but you against your own typical self over time. A meaningful change from your personal normal can be far more telling than the raw figure. Closely tied to all of this is something even subtler, the tiny variation in time between one beat and the next, known as heart rate variability. A healthy heart at rest does not tick like a perfect metronome. Small fluctuations, reflecting the constant push and pull between the accelerator and the brake, are actually a sign of a responsive, adaptable system. So the heart at rest is not silent. It is having a quiet, continuous conversation with your nervous system, and your resting heart rate is just one summary of that dialogue. Now here is the most important reminder of all. Everything described here is a mechanism, not a diagnosis. A resting heart rate, whether high, low, steady, or changing, cannot tell you on its own that something is wrong or right. It cannot replace an examination. It cannot interpret itself. Only a qualified healthcare professional, looking at your full picture, can decide what your number actually means for you. If you ever feel concerned about your heart rate, palpitations, dizziness, chest discomfort, or any symptom, that is a conversation to have with a real clinician, not a watch. But understanding the mechanism changes how you see the number. The next time you glance at your resting heart rate, you will know that you are not looking at a boring statistic. You are catching a glimpse of an electrical spark born inside your own heart, shaped by the silent balance of your nervous system, captured by light or electricity, and waiting for context to give it meaning. What looks like a single quiet number is actually a chain of invisible events happening inside you, every second of every day. If you want to understand the hidden science behind medical devices and the human body, explained clearly, visually, and responsibly, subscribe and keep exploring with us. Your body is full of these quiet signals, And once you learn to read them, you never see yourself quite the same way again.